All right, the next topic I want to talk is um, Eliquis versus Pradaxa or the big trend. So um, I have a similar indication. FDA approved for stroke prevention in non-valvular AFib, uh, venous thromboembolism treatment for prevention. Precaution. The Eliquis should be used in precaution when the creatine clearance less than 25 or the serum creatinine over 2.5. Typically, we use the Eliquis with a lower dose when people have this level, creatine clearance less than 25 or serum creatine greater than 2.5. For Pradaxa, um, we should avoid when creating clearance less than 30, and it's not recommended to start in patient with creating clearance less than 50. So creating clearance at 60 or above is considered a normal renal function. But when it's less than 60, it's not normal. And then when it when creating clearance below 50, then we should not start Pradaxa. And this medication contraindicated with patients who have mechanical heart valves, liver disease, active hepatitis, cirrhosis, a significant LFT elevation. When people have the AST or LFT greater than 2 to 3 times of their upper limits, then we should not start the Eliquis or Pradaxa. Pregnancy, people who are pregnant, they should be avoided taking this medication, Eliquis, Pradaxa. The side effect, Eliquis is better in terms of stomach bleed or GI bleed. Pradaxa might increase the GI side effects. So people who have stomach problem like peptic ulcer or the colitis or something like that, they should avoid taking Pradaxa. Dosing, the Eliquis and Pradaxa have similar dosing. They take they should be taken every 12 hours or twice a day. For the feeding tube, Pradaxa is not recommended. The Pradaxa dosage form available in capsules. So the capsules cannot be crushed or opened. Capsules may be stored. It must be capsules of the Pradaxa, but be stored in original containers for about when it's open, it's only good for 3 months to maintain the efficacy. When it's open and then it's over 3 months, the medication no longer have the efficacy that it should. So um, if we open the container, then we should not use this medication if it's over 3 months. With that issue, um, we don't recommend people to use the bubble bag. Um, you know, for some hospital patients, they used to have the bubble bag for like 90 days set up, and then this medication must store in the original container to protect from the light, and they should not be used in the bubble bag setup. The Pradaxa do not have interaction with the CYB3A4 drugs. It has a little bit different with the drug interaction. Um, the Eliquis had the antidote or reversal agent. It's called the andexanes alpha or andexa. The Pradaxa antidote is either brucizumab or Brexpide. So they have different antidotes or reversal agents. So generally, Pradaxa is less common than Eliquis. Pradaxa generally used for those people who have the good renal function and they are young. Um, Otherwise, Eliquis should be started in patients have the increased risk of bleeding, have stomach problems like peptic ulcers or GI bleeding, and have renal function problems. And the big um, disadvantage of the Pradaxa compared to Eliquis is the Pradaxa cannot be used um, in the bubble bag setup for the hospital patient. Yeah, the patient who need to use the bubble bags for their um, medication for all of their medication. All right, if you have any further question or concern, why we choose the Eliquis versus Pradaxa, or why we choose Pradaxa versus Eliquis, please let me know in the comment below. Thank you.